As an emergency physician, I see a lot of patients who come in with traumatic brain injury, and I can tell you there's nothing that pulls at your heart like having to go to parents and tell them that their child or loved one has been severely injured and there's really no treatment that we have available for them. And that coincides with meeting a mentor of mine, Dr. Donald Stein, who is a primary basic scientist who is doing work in traumatic brain injury. And so those two events coincided together and really got me interested. Hey, we've got to do something about this, and so that's how I got involved. The main focus of the PROTECT trial was to look for a treatment for acute traumatic brain injury. The PROTECT trial used progesterone, which is a natural hormone that lives in both men and women, actually, and was discovered about 35 years ago when Dr. Donald Stein was working in his laboratory. He noticed that his female animals kept doing better than his male animals. And so a lot of research went by, and he figured out that it was when progesterone was high in the animals, in the females, that they had a lot less brain swelling and were performing better on tasks. Since the original discovery in Don's lab, now over 300 publications looking at progesterone in some form of injury, brain injury in animals have come out. And so the data was very robust, and we were very excited that we may finally have a treatment for traumatic brain injury. The PROTECT trial was run through the Neurologic Emergency Treatment Trials Network, which is an NIH-funded network. It's actually one of the best networks that NIH has put together. Very efficient and excellent network that includes multiple hospitals and trauma centers across the nation. Before we conducted PROTECT, and actually during the designing phase, we were imminently aware of all of the failures of previous clinical trials in traumatic brain injury. This was a really huge effort. So we spent a lot of time thinking about why previous trials failed and trying to mitigate some of those issues. An example would be rapid delivery of drug. In animals, typically the time frame for them to get treatment was within an hour or so of the injury. So for our trial, we really pushed that and got drug delivery in under 4 hours. In fact, our average time was around 3 hours for getting the drug in, which is pretty amazing in a traumatic brain injury trial. Well, like all the trials before it in traumatic brain injury, unfortunately, it was negative. It did not show an improvement in the patients who got progesterone versus placebo. It was safe, but unfortunately, there was no effect. Well, the PROTECT trial was amazing. It had 882 subjects, but it was so meticulously conducted. Enormous amounts of data have been collected. We have all of the patient management data, we have biomarker data, and we have imaging data. And we're hoping that by providing this information out to the public and to other scientists, that they can look at this and continue to learn from the PROTECT trial. And that's the main reason we want to get it out into a public use data set, and FITBER is the perfect way to do that.